that's one of the factors that leads to obesity. And obesity has increased in United States. Right now in 49 out of 50 states, 20% obesity exists, and obesity is linked to diabetes, is linked to hypertension. So, it's important for everyone to maintain their weight. And how do you maintain your weight? You maintain your weight by exercising, eating healthy, and controlling the portion. It is very difficult to exercise. It is difficult to give up the extra food, but usually a habit is formed in 30 days. So you have to, even if it is hard for you, you have to every day try to follow those steps as far as cutting the portion, exercising daily, till it becomes ingrained in your soul, ingrained in your mind, that it becomes easier to exercise and eat healthier.
And you know, one of the things that I was just thinking, my grandmother was, I remember she was diagnosed with diabetes, and I was young. She must have been like in her 50s, maybe a little younger than that. And they put her back then in, must have been like in the 70s, with her weight management and also with proper eating. And she did very well on her PO medications, tablets, all the way until her 80s.
Yes.
You know, and I saw how really, you know, for her, from age probably 45, or she must have been 45 or 50 to age 80, they started putting her on the insulin injections. But that was kind of a success story, that she really took responsibility of her diet and her intake and her combinations of food. I wanted to talk to you about combinations of foods, because you were talking about protein and your carbos. Is there a correlation between combining them and how the body breaks it down that will make it healthier with carbo and protein, versus if you eat a carbo by itself, it turns into sugar? If you put a carbo and the protein together, it breaks it down easier. Is there a correlation out there?
Well, that I don't know as far as that, but I think as far as that metabolism of the carb combination, if synergistically they help each other to digest better, I don't think so. I think it's the digestion starts from, I tell my patient, from your, as soon as you put that first bite. And when you put the first bite, you take time to chew that food well. When you chew it well, there is initially the enzyme, the saliva that is released in your mouth. It's enzyme to break down the protein. There are necessary enzymes. There are enzyme that breaks down the carbohydrate, the protein, and as soon as you start chewing, that starts, the digestion starts in your mouth. And then as soon as you swallow, it goes through your stomach. There are other certain enzymes it's released
to break it down.
To break it down. So, and then pancreas is an enzyme, it's an organ that releases insulin to carry the sugar and the carbohydrate into your cell to change it into energy. And so as adult, as we get older and as we gain weight, and then your cell become resistant. So the insulin doesn't work. I call insulin is like a wheelbarrow, carries the sugar inside the cell. So we become resistant, and that's why the sugar lingers in your blood vessel. Okay. And the sugar, as sugar goes up in your blood vessel, then it's a toxic to your eye, the diabetic complication or pre-diabetic complication. It's damage to the retina of the eye, damage to the eye vessels of the eye, damage to the kidney, and damage to the heart and blood vessel and the nervous system. That's why people get silent heart attack, because you don't feel the pain, and they get the heart attack and they feel fatigued, tired, and or ankle swelling, or that's one of the signs of heart failure. And
the hypertension, I was going to talk to you now about the hypertension and diabetes. How do those two come together?
You know, the hypertension, diabetes, high cholesterol, those are the risk factor for heart disease, coronary artery disease. They are all equal, and they have they carry an increased risk for heart disease. And hypertension, what it increases risk of, it increases risk for it puts pressure on the heart. And the heart, because of the high resistance in the blood vessel, the heart has to work. I call heart is like a pump that pumps the blood to circulate throughout your body. And as your blood vessel, as we age or family history, hereditary, the blood vessel, the muscle, they become stiffened. And as a result of that, then the pressure, the heart has to work harder to pump the blood against that resistance. So what happens when you have hypertension, the heart has to work harder. As a result, the muscle gets thicker and then gets fatigued, tired. Then people over years, they can get heart failure. And what happens when the heart fails? As a result, the blood stagnates in the liver and then again backs up into extremity, into your lungs. That's why people with heart failure, they cannot breathe, they cannot walk. It's
so these are a lot of the clinical risks that you're talking about, and that's one of the questions that I want to ask you about the clinical risk and the not pre-treating the diabetes. And the pre-diabetes is the first stages of the symptoms of diabetes?
Yes, pre-diabetic is before you become diabetes. Pre-diabetic, there is a blood marker, we call it hemoglobin A1C. We measure that. That's hemoglobin A1C. It's a measurement of average 3 months of your blood sugar. So whatever you have been eating, if you one day you eat a piece of cake, the next day you're very healthy and you don't eat anything, everything is healthy, but the next day you eat something else, over 3 months, that average for a normal person, the level should be between 4 and 5.6.
4 and 5.6.
5.6. Above 5.6, we call it pre-diabetic. 5.6 to 6 or 6, we call it pre-diabetic, high risk for diabetes. Above 6.6 to 6. Well, that's high risk, and 6.4 is considered diabetes. Then you need to be really on medication.
And 6.4 would be considered classified on diabetes, classified as diabetes.
Diabetes.
Is that a diabetes 1, 2, or do you?
No, that's diabetes general. But diabetes type 1 and type 2 is different. That's diabetes type 1.
Tell me about type 1 and type 2, how different are they?
Type 1, usually it happens when you're younger age. Type 2, it's more adult onset diabetes. That's after age 40. And usually type 2 diabetes adult onset is because of our lifestyle, overeating, weight problem, poor exercise, not enough activity. As a result, then your body doesn't digest the carbohydrate.
Are they already taking injections? Diabetes type 2, are they going to administer injections, or can they take still a PO medication?
For type 2 diabetes, the first line of treatment is first we offer the exercise lifestyle changes. If a patient is really adamant about it and really responsible and wants to do well and not to go on medication, I usually offer them 3 to 6 months to see exercise and diet.
And controlling through diet.
See if we can make them lose weight and control their sugar, so if we can shift it to the normal or control with diet and exercise.
Have you seen success stories
where
people that are compliant and they say, I want to take control of my diabetes?
Yes, definitely.
You have seen it?
Oh, yes, definitely.
Through your recommendations?
Yes, definitely. Coaching and coaching patients and encouraging patients and seeing them often to help them to lose the weight, help them to losing weight is important, and helping them follow their diet and exercise plan. And also we put them on medication. So type 2 diabetes, usually it's oral agent. We use pill medication orally to help them to control the diabetes. But if it is not controlled and hemoglobin A1C below 7 is considered control. Above 7 and above 8, then patient, they are supposed to go on insulin injection. So it's important from the beginning, patient realize that the complication of the diabetes and how important it is for them to change their lifestyle.
And you keep talking about exercise and emphasizing exercise, and diet. Why do you keep emphasizing exercise?
Because I think exercise and dieting and eating healthy, it prevents a lot of diseases. If you eat small portion, if you choose healthy food, then you will not gain weight, you will not have weight problem that leads to diabetes or hypertension or hyperlipidemia. So it is important every day patient to walk at least 30 minutes a day.
And it doesn't have to be a strenuous type of exercise, like you were saying, just walking, hiking.
Hiking, biking, whatever, choose a sport that you like. If you like bicycling, you can get, it's hot, you can get a stationary bike. You can sit down, watch your favorite show, and do the 30 minutes of cycling, or walk in the pool, or walk on treadmill, or elliptical is good for the knees, so it's not a high impact. So if you can't do exercise 30 minutes in one session, you can start 10 minutes. I tell my patient 5 minutes, start with 5 minutes first week, second week to go to 10 minutes, and do it in incremental, like interval, like do it in the morning and then in the evening, 10 minutes in the morning, 10 minutes in the evening, and then go to 15, and if you can do 20. The benefit of cardiovascular from exercise reaches after 20 minutes, because it takes you have to work 20 minutes that your heart becomes efficient and start releasing those hormones and breaking down the carb and losing weight. So it's best to do about 20 minutes to 30 minutes of exercise
and enjoy it.
And enjoy it.
And enjoy it. I hadn't worked out like in 2 months myself, and I went back to the gym yesterday and I said, I'm just going to take it slow from this point, you know, and work my way up to an endurance, a good endurance, and then start getting into, you know, a little bit heavier workout. So, Dr. Heydarian, I want to thank you for being in our program today. The topics that we discussed, where, especially with the hypertension, I learned a lot about diabetes and hypertension. Where, again, can they get a hold of, if they want to make an appointment, where can they call you?
They can call my office at area code 915-845-4600. And we have a website, westwindmedical.com.
Westwindmedical.com.
Yes,
okay.
They can look on the website. There is information about our practice and the services we provide, and the location. And also we have a library of information that they can read about different diseases and learn and help themselves, patients help themselves to be educated. And they can reach us and we be glad to see them. And we accept most major insurances
and Medicare. Location, address?
Location is, it's on the west side, 6604 West Wind. It's on the corner of West Wind and Escondido.
Dr. Heydarian, I just want to thank you for this topic and for being in our program, Choices to Benefit the Aging. Thank you, Dr. Heydarian.
Thank you very much.
Thank you for watching Choices to Benefit the Aging. Again, I'm Joe Urrutia, your host. If you have any questions regarding your home health or hospice Medicare benefit, you may call me at 544-0044. The number again is 544-0044. God bless you, and thank you for watching us on Choices to Benefit the Aging. God bless you.
Choices to Benefit the Aging has been brought to you by Choice Home Care and Hospice. For more information on this program, go to El Paso Southwest Senior Magazine.